Hey, my name's April Sharp and I'm going to give a presentation on best strategies or interventions to promote breastfeeding after a patient is discharged from the hospital. This is for my senior project for Columbus State University. So in labor and delivery, we do have a problem when patients are discharged from the hospital with them continuing the breastfeeding. All moms are encouraged to breastfeed before they come into the hospital, and a lot of moms are very excited about that. But then once they get here to the hospital and they see the challenges that come along with breastfeeding, some, after they no longer have the support that we offer, do not continue that. So this is my presentation on ways to improve that and make changes to that problem. Why do we want patients to breastfeed? We all know that breastfeeding is important, but do we know why it's important? Breastfeeding always provides the best nutrition for our babies. It also provides immunities for the infant that are passed from mom to baby. It's the most cost-effective form of nutrition for families. We all know that a lot of families are in financial strains, and that is very cost-efficient for the family. It promotes bonding at an early stage of development when mom is able to hold that baby very early after the delivery and able to bond with that baby. That creates a better relationship early in that relationship. So some of my objectives for making this change is to increase the number of breastfeeding classes that the hospital offers. This will help moms to have more education before they come into the hospital on breastfeeding and ways to continue breastfeeding after discharge. My other plan will be to hire a lactation consultant that will provide breastfeeding support in the inpatient setting as well as follow-up after discharge. I feel that when patients see a lactation consultant when they're in the hospital and that lactation consultant is able to follow them after they're discharged, they get more of a relationship, they feel more comfortable, and are more able to ask questions that they may not would ask a stranger. I also want to increase and improve breastfeeding materials to be given at discharge. A lot of patients, if they're not given things hands-on to be able to read and go through after they're discharged, they may not feel that they have that support without calling someone. So this gives them something that in the middle of the night, if a question comes up, that they're able to pull that educational material out, read for themselves, and maybe that would help to answer some questions as well. I also want to see an increase in the number of mothers who continue to breastfeed their infants after they're discharged from the hospital, and I'm going to talk about ways that we can assess that after the change is made. Why do we want to change? We want to improve the health of our babies. Like I said, first and foremost, the health of our babies is number one. We want to, by improving this, it leads to healthier adults in the future. So when we make sure that that baby gets a well nutrition early in the stage, then that leads to healthier adults later in life. It also aids in preventing obesity. There are many studies that show that a baby that is breastfed is less likely to be obese later in life. And like I said before, it's also cost effective for families, and it decreases the amount of government support that is needed, which we all know affects the economy. So my question, will mothers show an increase in continued breastfeeding after discharge if they're given more support from written information and a lactation consultant? That's the question that we will be asking ourselves as we make this change. So I did a lot of research on making this change and found several great articles that discuss breastfeeding, how to make patients continue breastfeeding after discharge, and why it's good for our babies. The first one was by DeFrisco, and he stated, growing evidence indicates care practices during the prenatal and intrapartum periods are critical for the success of breastfeeding, particularly exclusive breastfeeding. This article was helpful because it discussed a hospital that strives to become baby friendly. Many hospitals are striving to do that, and so that's a change that's being made already. It provided a study of mothers who initiated breastfeeding within the first hour of delivery, and if this contributed to them continuing the breastfeeding for at least 2 to 4 weeks after discharged. So we all know, working in labor and delivery, that it's very important within that first hour of life that that baby goes to the breast, that we provide that support for mom while that baby's very alert and active. The baby latches on much better, and so it's very important that we initiate that. The next article that I researched was by Erickson, and he stated, breastfeeding has been shown to be highly beneficial for nutritional, immunological, and cognitive development. This article discussed the importance of breastfeeding, specifically preterm infants, and reviews the challenges that these mothers may face. With our preterm babies, we all know that they're not born with a sucking reflex as well as a full-term baby. And so this is a challenge that those moms will face. It also discusses with preterm infants how important it is for these babies especially to get that nutrition. And so this article was great in saying that we should make sure that we educate our moms that are going to have or have the potential to have preterm babies on the things that they may face beforehand, so that they maybe do not feel as anxious after they deliver. It's important, like I said, that we discuss them prior to them experiencing the problem, because after the problem arises, if they know what's coming, they already know what to expect, and they're better able to handle those. The last article that I reviewed was on MAH00260, and they stated breast milk is regarded to be the best nutrition for preterm infants. I felt that this article was very important because it gave proof as to why we want the babies to breastfeed, and number one is their health. It was helpful in identifying practices that may affect breastfeeding of preterm babies, and it also discussed the use of nipple shields and pacifiers. That's a big challenge in labor and delivery, and there are different feelings for nipples and for different nipple shields and pacifiers. So I felt that this article gave great information on the use of those and how it will affect a mom with breastfeeding. My recommendations for making this change would be to add helpful educational handouts to the discharge instructions. That way those moms have those to be able to read over. Provide the breastfeeding classes to parents before delivery so that they already have the education before they face delivering the baby. And that we provide a lactation consultant who will help with breastfeeding while they're in the hospital, as well as follow up with problems once they go home. So after this change is made, it's very important that we evaluate those changes to see how they affected our unit, if they affected them in a great way or didn't help as much as we thought that they would. With the evaluation, my suggestions would be that after the changes are made, feedback will be collected over a period of 1 year. Evaluations will be given after the period of 1 year to evaluate the effectiveness of the changes that were initiated. Surveys will be placed in the pediatrician's office for parents to complete at the 6-week checkup in order to evaluate how many continued the breastfeeding after they were discharged and how long they continued that breastfeeding. Questions regarding what parents liked and disliked will be added to the patient satisfaction survey at the hospital, and this will give us feedback on the changes that they like and the changes that didn't help them out as well. My expected outcomes are that there will be an increase in the number of moms who continue to breastfeed after they're discharged, that there will be an increase in patient satisfaction due to the added education that we're going to provide to them, and that there will be a decrease in the number of illnesses in infants due to extended breastfeeding. So to conclude my presentation, with the efforts of physicians, nurses, and parents, we can improve the health of our babies by encouraging this breastfeeding. By increasing the amount of time a mother breastfeeds, many benefits will be able to be seen. These benefits will continue to be passed from generation to generation, changing the way we as a nation view breastfeeding. These are my references, and thank y'all so much for listening to my presentation. And does anybody have any questions at this time? Okay, thank you so much.